Welcome to the July issue of the AJP-Heart and Circulatory Physiology's video table of contents, or from the editor's desk. This month, we bring you some outstanding original research articles and reviews. As of today, July 11th, our July issue contains 3 reviews, 14 original research articles, as well as 1 editorial focus article. I highlight here only a few of the excellent studies published this month. Please go to our webpage and peruse all of the published studies. Let's take a look at some of the articles in this month's issue.
In a review by Morgan et al., they describe how telomere uncapping potentially leads to age-related vascular dysfunction and increased cellular senescence, oxidative stress, and inflammation. Importantly, they present evidence to argue that telomere uncapping is more biologically relevant than telomere shortening and a better marker of vascular aging and target for anti-aging interventions. Elstad et al. Review 3 types of cardiorespiratory interactions: respiratory sinus arrhythmia, variability in heart rate at the frequency of breathing, cardioventilatory coupling, synchronization between the heart rate and the onset of inspiration, and respiratory stroke volume synchronization, the constant phase difference between the right and the left stroke volumes over one respiratory cycle. The putative mechanisms driving cardiorespiratory oscillations as well as the physiological significance of these oscillations is discussed. The authors argue that restoration of this variability via pharmaceutical or device-based approaches may be beneficial in prolonging life. Mouton et al. Review mechanisms thought to be responsible for the transition from the post-MI state to heart failure. The review discusses current knowledge gaps and recent development of the role of inflammation and the extracellular matrix in myocardial infarction remodeling. In particular, they focus on the macrophage as one cell type that provides direct and indirect regulation of both the inflammatory and scar-forming responses. They summarize current research efforts focused on identifying biomarker indicators that reflect the status of each component of the wound healing process to better predict outcomes. Knudsen et al. Used the elastin heterozygote knockout mice to test the hypothesis that pathologically increased vascular stiffness with concomitant arterial narrowing leads to decreased blood flow to end organs such as the brain. They hypothesized that drugs that remodel arteries and increase lumen diameter would improve blood flow. To test this hypothesis, they compared carotid artery blood flow using ultrasound and cerebral blood flow in wild-type and elastin knockout mice. They then studied and examined how minoxidil, an ATP-sensitive potassium channel opener and vasodilator, affects vessel mechanics, blood flow, and gene expression. Both carotid and cerebral blood flows were lower in knockout mice than in wild-type mice. Treatment of knockout mice with minoxidil lowered blood pressure and reduced functional arterial stiffness to wild-type levels. These results indicate that elastin insufficiency impairs end organ perfusion, which may contribute to the increased cardiovascular risk. Skyshally et al. Studied the mechanism of remote ischemic preconditioning during myocardial ischemia in anesthetized pigs. Hind limb ischemia reperfusion during 60 minutes of coronary occlusion was used as the experimental paradigm. Remote ischemic preconditioning reduced infarct size and increased STAT3 phosphorylation at early reperfusion. Remote ischemic preconditioning plasma, or plasma dialysate, reduced infarct size in rat from 22% of ventricular mass versus 40% compared to placebo plasma. Mitochondrial function was improved, and remote ischemic preconditioning dialysate also improved the viability of mouse cardiomyocytes after hypoxia reoxygenation. McDonald et al. Examined the role of secreted protein acid enriched in cysteine, or SPARC, a matrix cellular protein that has been shown to be required for insoluble collagen deposition and increased myocardial stiffness in response to pressure overload in mice. As macrophages are associated with increases in fibrillar collagen, the hypothesis that macrophages represent a source of increased SPARC production in the pressure overload myocardium was tested. In pressure overloaded hearts, mRNA encoding collagen type 1 was increased at 3 days, whereas increases in levels of total collagen protein did not occur until 1 week and were followed by increases in insoluble collagen at 2 weeks. Increases in muscle stiffness were not detected before increases in insoluble collagen content. Significant increases in myocardial macrophages that coincided with increased spark were found but did not coincide with increases in mRNA encoding collagen type 1. The authors conclude that myocardial macrophages play an important role in the time-dependent increases in spark that enhance post-synthetic collagen process insoluble collagen content and myocardial stiffness and contribute to the development of fibrosis. Finally, an interesting study that impacts cardiovascular scientists that carry out rodent echocardiograms was carried out by Donner et al. These investigators hypothesized that informal training in preclinical research may be a contributor to poor reproducibility of preclinical cardiology research and low rates of translation into clinical research and practice. The aims of this investigation to assess the inter-observer variability of echocardiographic measurements from studies in mice and address any technical impediments to reproducibility by implementing standardized guidelines through formalized training. Standardized formalized training improved participant mean absolute percent error by about 30% relative to expert calculated LV mass. The authors conclude that this report reveals an example of technical skill training insufficiency likely endemic to preclinical research and provides validated guidelines for echocardiographic measurement for adaptation to formalize in training programs.
Thank you for watching this month's AJP Heart and Circulatory Physiology's video table of contents. If you haven't already heard, our impact factor has increased this year. We are clearly on an upward trajectory. Our submissions to date have increased about 15%. Our reviews, guidelines in cardiovascular physiology, and original research papers have been very well received. I also want to put in a plug for a one-day conference that will be held here at the University of Nebraska Medical Center on October 2nd. Our associate and consulting editors will present their latest science. There's no registration fee, and we would love to see you here. Please go to our website for complete information and registration details. So we'll see you next month, and don't forget to keep sending us your best science now.